today's talk is going to be very simple and more of a question and answer session. And I don't know how many of you all have read what has come in the Navhin Times. Good. You can go home now. That's a good one, right? Yeah. So, I have been interviewed quite a bit. And then the advocate Cardozo, where is he? There. So he's friends with another cardiologist, and we were talking about food habits. Now, and this is the same thing that I talk to my patients in the United States. Let's look at, we're getting older, right? Most of us. So if we're getting older with the food, which are calories, with the alcohol, which are also calories, we're not going to go any taller, right? We're only going to go sideways. So what do we do to stop that? So if we've taken in calories, we need to put out the calories. And simplistically saying is that those calories are not going to be expended unless we expend them with activity. I have a Fitbit here, and I don't go to have my supper unless I've done 10,000 steps. Okay, or if I have 2,000 more steps to be done, I'll have my supper and I'll walk in my house itself. My wife used to wonder, what the hell am I doing in the house walking? Even at Cesar's place when I stay there in the morning, I'm always walking because it's a good time to walk. And I think you look at all our forefathers, what kept them going for a long time? First, they couldn't afford, even if you were wealthy, you were a big landlord, small portions. Second is big lands, you had to walk. You just couldn't sit here and watch the padkar dropping the coconuts from a distance. So walking was involved. So we had no cars, exercise, food was expensive, smaller portions. And then we did not have too much of, what do we have now? A TV, internet, a lot of these things that don't allow us to sleep. So at my time, no young people had high blood pressure. But why do people have 30-year-olds here in the United States have high blood pressure? Because of the fact is that they don't sleep well at night. Everyone's on the internet. And if they only realized, why do we need sleep? There are 2 times in the day when your blood pressure drops. One is from 2 o'clock at night to 5 o'clock in the morning when you need to sleep. And the second time is 3 o'clock in the afternoon, which you'll be shocked that I sleep in the United States as a practicing doctor. So people ask me, how do you manage to sleep? So I shut off my phone, and the hospital knows to call me only if there's an emergency, a true emergency. But otherwise, they know that they don't call me unless it's a true emergency. So we have to go with the flow. And what is the flow? If you keep awake at night, what are you doing to your blood pressure? Instead of going down, you're keeping it up. What happens in the afternoon when your blood pressure goes down? If you have an opportunity, take some rest. Siesta is not meant, actually things are changing all over the world because of the American way of life. And unless we sleep in the afternoon, actually I don't know if you're familiar with Google, they have a sleep room. A lot of places now have these pods where for an hour you can just go and fall asleep or close your eyes and soothing music. So I think this is the key. There's nothing new. It's all old, which our grandparents did, which none of our younger generation has been doing. I was just talking to this young man who had come to interview me. My own nephew, who's 18 years old, I asked him, have you seen the college where I was in? I was in Chogle College. And I said, I used to bicycle to Chogle College. come rain, come, hot sun, whatever, we used to bicycle. So rain, if it rained, some of the puddles, you'd carry your bicycle and walk across these tiny rivulets and bicycle again. So I asked my nephew, I said, have you ever bicycled? Do you know what's a bicycle? So I was a little surprised. I said, what sport do you play? I play football. What position do you play? Backs. I said, backs, unless you're Cafu from Brazil, was the only back who could go back and forth. The other backs are just standing back. So it's interesting that we have to apply simple-minded solutions. Simple-minded solutions. There is going to be a problem here is, we are lucky to have Goa Medical College. It offers us the best care. But the best care, what happens post-care? What happens post-procedure? So Dr. Guru Prasad Naik, good friend of mine, has put in a stent, talks to me and says, can we afford all the stents? How much of money does the government have? It's only a finite amount. So if he is going to put stents in everyone who comes in there, we are going to be bankrupt, right? So we need to have a lifestyle change. And a lot of people really don't follow up after a procedure. Agreed, that is not a concept in this country. We don't talk about maintenance. So you have a car, you have a boat, you have a house. Nobody thinks about the house that you built a 1 crore home, and there's a sinking fund you need to have. You need to have maintenance, because if it rains, you got to paint your place. So the same thing with our body. You put in a stent, it's not the end. It's just the beginning of change in our lifestyle. So I think if we can change our lifestyle, you'll be not running to the doctor, you'll be running away from the doctor. And I think it's important. I tell this to my patients a lot of times. I have 100-year-old patients. 100, 101, 90. I have my class of 90. That I have like 30, 90-year-olds. This 100-year-old, 101-year-old woman, she bakes cakes for Christmas. And I've even taken a selfie with her. Active woman. And I think my mother is 91. She's very active. So it's important to keep active. And if we don't keep active, I've even talked to my brothers, I'll give you 500 rupees to walk on the band so that you won't have a heart problem and I won't have to pay for it afterwards. So at least if I pay you 500 rupees to walk every day, incentivize him to walk, at least they'll get into it. And I'm not talking about running, I'm just talking about brisk walking, simple brisk walking. More important is processed foods. I want to ask how many of the audience here had cheese daily 35 or 40 years ago. I know that I didn't have cheese, maybe it must have been 2-3 times a year when I was, now cheese has become the norm. But cheese is processed. How is cheese made? With salt. How is butter made? I remember when I was 6 or 8 years old, only on Sunday we got butter. We were 8 kids. So only on Sunday we got butter. So that was the only time we ate butter. So I think it's important for us to realize that these things, the buying power has increased in the middle class, but not necessarily the buying power is good. It's not necessarily, instead, if we can utilize the buying power to eat healthy, that will go a long way. That will keep us away from the doctor. So I think I'm ready to take some question and answers. And I think they have a mic. Whoever has a question, feel free to ask the questions. Because let this be an interactive session more than anything else.
Let everyone hear your question. The question is, is it necessary to have a walk in the morning, or is it enough to walk 10,000 steps per day?
Exactly. It's 10,000 steps per day. More than 10,000 because that's what I do. 10,000 steps, figure out how many miles it is, how many calories burned. Nobody takes a step. We are not paralyzed. I think we take brisk steps. So 10,000, more than 10,000 steps is extremely important. So at work, you just made that common sense. I walk 4 stories instead of taking the elevator. My mother we lived on the 4th floor in Bombay, so she used to take the 4 till 8:55. She walked up 4 floors up and down twice a day. So that in itself helped her a lot. Any other questions? Give them the mic.
You mentioned in your article that it's not necessary to do preventive health checkups like yearly, but don't you think that it's better those checkups will tell you if something is, going wrong or?
Now, everyone has heard this. So I'll give you a very simple example. There's this driver whom I'd hired 6 years ago. So every six months he would do his cholesterol. So I said, how much do you pay for your cholesterol check? He says 150 rupees. So you come, you drive me, and you're sitting on your butt all the time. Why are you doing your cholesterol check? So 150. So I'm going to deduct 150 from your, whatever I pay you, 800 rupees. I'm going to deduct 150. Where is the rocket science in doing tests? I'll give you concrete examples. The test is at that time. So suppose I'll come back to that test and what has happened to a couple of my patients. My own uncle, he had a nuclear stress test when he came to my office, and it was free because it was my practice. 6 or 9 months later, he had a heart attack. Now his nuclear stress test was normal. How come he had a heart attack? Can you explain that to me? Or do you want me to explain that to you? So simply stating is, it's at that window of time. So nowadays, in the United States, if I order a test, any test, including a blood test, I need to document why I am ordering the test. Is the patient having symptoms? No, somebody could say, like just recently, a well-known guy from here came to me because his friend died. His friend died. So I said, you had an echocardiogram. You had a heart attack 6 years ago. So you had an echocardiogram done in the month of February. And then you had an echocardiogram done in the month of July because your friend died. Is that your brother who died? No. So no. So I said, what do you do for a living? I sell gym equipment and I bicycle 30 kilometers a day. So I said, that's a total waste of resources. So then I joked with him, hey, by the way, your echocardiogram shows that you had a heart attack. So we should do an angiogram on you. So this is what we do to ourselves. You know what I tell a lot of their patients who come to see me? You are a bakra, ready for Bakri Eid. And then we blame the doctors. Right? My aunt came, she's 79, she's very active. We have very good genes on both the sides. So, my friend died, she was 71. So I said, what's wrong with you? She's 79, this one was 71, was diabetic. My aunt doesn't take any medication, she lives here. Just to make you happy, I'll do a stress test. He did very well. I said, it's just a test. And some of the tests that are done here don't have standardization. So how do you believe these tests that don't have standardization? So you tell me this echocardiogram that was done at Apollo, which is normal, 6 months later was slightly abnormal. Was it preying on your mind to generate another test? But who's to be blamed? Not the doctor, because you are a sitting duck waiting to be shot. Right? You don't want, what people don't want is simple, we say in America, KISS. Keep it simple and safe. Or keep it simple, stupid. Simple. We look for tests. We pass the test, but we fail in our life. We pass the test, but we fail in our life. Because, I've given you 2 examples of people whose tests were normal. And if you want to be investigated further, then that's your problem. If you have no complaints, if you can tell me what you've read in literature, that will force me to order a test on you, I will be more than happy. And I encounter this even in the United States. Oh, my husband's brother's wife's sister died. So I said, are you related to them? No. You walk, you exercise. Why do you need a stress test? I've had people who've come for 30-year-olds for executive physical. So you walk. Why do you need a stress test? Give me one reason. If someone can, illuminate me on that, a test is a total waste. Yes, if you have cholesterol problems, if you have real issues, then diabetes, you need to find out your HbA1c. Extremely important, not your blood sugars. And I'm going to use this, this one guy comes in, HbA1c is 11. And doctor, my blood sugar, I said, you know what, I can cheat and do the same thing. So it is cheating. So I think it's important. Diabetics need to have extreme close monitoring. Those people who are on lipid lowering agents like cholesterol agents need to have close monitoring. But it's not every 3 months. If you keep exercising, I've actually stopped, I've stopped medications on some patients in the United States. Actually, if I had some way of showing you what my 69-year-old patient who had 3 stents put in at age 60, his father died at 59, he's alive at 69, what he does, what he eats, I have all the pictures, you'll be startled. So I'm actually, when I go back, I'm going to put all his pictures together in a file for my other patients because he's my poster child or a poster boy for good health. So I think I have a 71-year-old patient who's my neighbor whose heart function is just 15%. He walks 3 miles every day. 3 miles every day. So what does it tell you? He's doing very well, he's lost weight, and it's important. So the test is, unless you have an ongoing problem, you don't do a test unless you are having symptoms. And then we always risk stratify. So a young person comes in with chest pain, no family history, active, we'll do a regular stress test. Somebody who's a smoker, who has a family history, then we do a nuclear stress test. A 55-year-old family history smoker, diabetic, comes in with chest pain. Just tell you what happened recently. So I like to just talk to my patients and wheel them myself so that I can chit-chat with them as I'm wheeling them around to the nuclear stress lab. So I said, he had pain for a week on walking uphill, just walking a flight of stairs. Smoker, and his brother died at age 49. So I said, as I'm wheeling you, you can have the nuclear stress test or you can have a cardiac catheterization. So I said, we'll do the cardiac. He had 3 vessels. One was 100% blocked, 2 were 99%, which we fixed, and he went home the next day. But he had real symptoms. So good history taking. Unfortunately, it has become, what we're talking, I have residents and I have medical students. So first thing is that they'll do an echocardiogram. I said, can you teach me something that I don't know why you've done an echocardiogram? Can you teach me something that maybe you learned something last night when I was in bed that the patient needs an echocardiogram? Can you teach me something why this patient needs a stress test? Can you teach me something? Because it has become a knee-jerk reaction, even in the United States, test, 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 test. It's not going to make a big difference. I tell them a good history taking is very important. Good history taking is very important. It hasn't changed. It was then, it is now. A good history is the most important thing. So someone, I've had a friend of mine, he used to walk, I'll use his example, he used to walk every day. Suddenly, he used to walk for half an hour. Suddenly he realized that after 10 minutes he was getting chest pain. A man who was walking for half an hour, so immediately he had a yardstick to go by. A man who was walking for half an hour, after 10 minutes he's getting chest pain. And thank God he was walking. Thank God he was walking, because I tell people that's a yardstick that they can go by. He had to have bypass surgery for very good reasons. But that was excellent, right? He had a yardstick to go by. So to me, test is a waste of time. Test is a waste of, unless you have risk factors, then you can consider doing a test. So like I always joke with my residents and interns and medical students, you know, why don't you do a brain scan on the patient to see if he has a brain too? You know, I'll give you an example. There was $1,000, you could get a whole body scan in the United States. So people were having whole body scans. Guess what it resulted in? $1 million workup, because you found something here, you found something here, you found something here, you found something here. What do we do with that information? So I tell my residents, doctors, what are you going to do with that information? Order a test if you're going to do something with that information. But if you're doing a test just because you woke up in the middle of the night and decided to do it, doesn't work out. It adds to the cost of healthcare. Now, in the United States, we have what is called bundled payment. So a patient comes to the hospital, whoever orders tests, unnecessary tests, is going to go out of his kitty. So there's a $10,000 for this admission. If whoever orders keep on ordering tests unnecessarily, he's not going to get part of his paycheck. Very simple. There's only this much of money, right? And so we think, it's so sad that how we've generated this thought process in this country. My cousin had ovarian cancer. So the doctor says, what is your budget? You know what? She would have punched the doctor in the face. But why? We are the ones who allow that to happen. We are the ones who want unnecessary testing. We are the ones who contribute to their wealth. And so, if you come to my office, how do I get rid of you? Okay, what test you want? I'll do it. Make you happy, make the referring doctor, make that guy happy, because he's going to give me a kickback. So we're all happy. You are happy, he's happy, I'm happy. We're a happy family. Right? But in the United States, we can't do that. There's no referral, no kickback, and every time I do it, why is it being done? I have to document. So, and we have lawyers who are looking behind our backs. So we cannot do unnecessary. And sometimes these doctors say, oh, lawsuits. I said, rubbish. If you document rightly what your thought process is, and medicine is not a science, right? Medicine is an art. It's the art of the science of medicine. So if we knew medicine was science, then we didn't need doctors. We could just You came in, punch everything, have the diagnosis, right? Or some patients came in, one patient came in with chest pain, got a history, another patient with chest pain, and two different people get two different treatments because it's a good history-taking skill. So test is your only allowing yourself to be a sacrificial lamb.
What's your comment on the regular pathological tests that, one is kind of getting SMSs and being marketed these days by certain pathological companies like Thyrocare and Arogya Pro and regular, they give you a nice package, like from one to all, does that help in taking a better condition of your body, like cholesterol and all that?
No, very good question. And answer to that question is I've not done any tests on myself. My only tests have been when I got my life insurance physical. My numbers are good. I keep up what I tell my patients to do. My wife makes fun of me because I had an old belt which I constantly use so that I know how many notches I've gone tighter. Actually coming to Goa I put on 2 pounds. I've not been able to exercise much, and some of the yesterday I had a samosa at a friend's place, which was, look at the whole problem is, it's carbohydrates, potato samosa, it's wrapped carbohydrates, and in grease. I don't call it oil, I call it grease. Because then you take a paper towel. So why won't people who love these samosas not have diabetes? And coming back to diabetes, it's a very simple thing. I want you to think simplistically. I tell my patients a simple thinking. This is a horse, this is a carriage. And some of you all who've seen this, there's a show, horse and carriage, love and marriage. So I sing to them too. So I said, this is your heart, this is your body. Now figure it out. Your body has grown this big, and the horse is the same and getting sick. Can you flog a sick horse? So what do? Is throw out all the weight and then the horse can move. Diabetes, this is your pancreas. Your genetic makeup is pancreas this size, your body has gone this size, or this size. What's going to happen? Or even very simply, it's in the Navin times, I give this a very simple example, is I have a half horsepower pump for my garden. Suddenly I buy another acre there and decide, I'll use that for the other part too. What will happen to the pump? This is what happens with diabetes. And another thing, coming back to the test, I suddenly realized, which I tell my patients, there's an 8th grade lesson that I learned. So there is this guy who has a donkey and he goes to the fortune teller. And I use these examples with my patients. So I say to them, this guy goes with the donkey and says, when am I going to die? So the fortune teller says, when your donkey sneezes 3 times. Coming back to test. So first what he does, oh my God, I can't allow my donkey to sneeze. So he sticks some tiny stones and they go happily up the hill. The guy falls off, oh my God, he sneezed once. Then he puts bigger stones, a little up the hill, donkey sneezes twice. Oh my God, I'm going to die, he's going to sneeze. So he puts sand and goes up the hill, sneezes so violently, the guy falls off and dies. Coming back to your test. So this is, if they don't register as yet, my patients, and I tell them, my sister-in-law had cancer of the colon at age 53. She died. She was a doctor. Then, my brother-in-law had bypass surgery at 55. He was a smoker. Some of the people here know him. So then my sister-in-law, who was here, comes to the United States because the sister is dying of cancer. So what do? we do a nuclear stress test because my wife is bugging me. So I said, okay. So we do the nuclear stress test in my office. It's normal. And we do the colonoscopy, which is normal. Guess what happens to her 5 years later? She has a condition called motor neuron disease, and she dies at age 69. Did the test help anything? What is the moral of the story? And what people don't realize is with these tests, say CT scan, angiography, there's radiation involved. And, like I tell my patients, when I fly, said I could be dead tonight, right? So all the tests may be normal, but I could still be dead. So yes, if your risk factors are there, then you consider doing tests. But without risk factors, there's no point in any. If you're diabetic, if your cholesterol is high, you do a test, you do a nuclear stress test. But even if your nucleus is normal, you still need to modify your lifestyle. Good sleep, lack of sleep causes hypertension. Exercise, expend your calories, right? And diet, decrease your calories. So 1, 2, 3, and to me even the processed food can be one reason. I may be wrong, but carcinogens. And why good sleep is because if we don't sleep, stress level goes up. And give you an example, a very simple example is, even if you have a 50% blockage, your stress test can be normal. But that 50% blockage is a soft plaque. Every time you have stress or a lack of sleep, that plaque which is 50% in this vessel, every time you go into stress mode, it goes into spasm, causing this 50% blockage to break up and cause a heart attack. So if there's no lifestyle modification, go ahead.
If I can pursue the business of tests at the moment, doesn't the propensity to ask for or engineer a test, does it not depend upon the type of society in which you live? If you're living in a place like India, I'm originally from England. If you're living in a place like India, like say Bombay or Goa, you are to some extent dependent upon your doctor who may want to order a test, not necessarily because you need it, but because he, for his own reasons, wants to order it. Now, I don't want to elaborate on that, but you know what I'm getting at. That's one side of it. If you're living in England, for example, as opposed to living in America or India, you'll find that the doctors are very hesitant, both in terms of medication as well as in terms of ordering tests. They're very hesitant to do that unless it is absolutely necessary. And so what I'm really trying to say, don't you think that the type of society in which you live and the type of doctors that you have are to a large extent responsible for the fact that you have a test or not? That's one side of it. The other side of it is where I don't agree with you is, whilst I agree that you shouldn't voluntarily ask for a test unless you need it, surely a test is necessary for monitoring purposes. If you've had an event in your life, a heart attack or whatever it is, then surely you do need a test to monitor your situation to ensure every 6 months or every 1 year or so forth that it is under control. Now that surely is necessary.
Very good question. Guess what's happened? Coming back to your monitoring of a heart attack. This is a 20-year-old story. We didn't know better. So, and we were doing nuclear stress tests on everybody who had an angioplasty because we did not know any better. Every 3 months, every 6 months, every 1 year, every 2 years. So then they have this data, not 1,000, 2,000, about 100,000 patients. That's the beauty of data collection in the proper format. 20 years ago, when we did nuclear stress tests, we didn't know better, so we did it. Because exactly coming back to, isn't the way to monitor the patients. And we realized that first there's radiation involved, second there's cost involved, and third, once the patient has followed what is needed, really the progression of disease is not there. So therefore right now, when I do a test, I'll give 3 examples. So I told you about this young guy, family history, smoker, whom I was taking him to the nuclear stress test. He never had a test at all, first time he came in. But his pre-test probability was much higher, family history, smoker, so I took him to the cath lab and we fixed it. Versus somebody else, his age, who has no risk factors. See, this is a good history taking. No risk factors comes in, I would do a regular stress test. And then somebody who has come in with chest pain, not often, but infrequently, diabetic smoker, then I would do a nuclear stress test. So we have been fortunate enough that we've gone through this data of patients that nowadays, in the United States, Medicare guidelines, if the patient has no symptoms, no testing is allowed. I just saw a patient here. He had symptoms. I'd done a nuclear stress test on him 2 years ago. I'd sent him for a nuclear stress test here itself. So he came in with new symptoms. So I did a nuclear stress test again. I know his anatomy, so I did a nuclear stress test. It was slightly abnormal, and he's living off just one bypass. And obviously they're worried. So I said, you're doing so far so good. If you have problems, we have Guru Prasad Naik, we can talk to you. But he's a man who's had a lot of disease. But a majority of us, we've seen in the United States now, if you abide to your maintenance program, if you abide with your maintenance program, you're not going to get into trouble. When do we get into trouble? When you have not abided by the maintenance program. And what's the maintenance program? Is they come back to see us 3 months, 6 months, and then every year. So, we'll check your lipids, we'll ask you what's happened to your body weight, we'll ask you whether you exercise. So all of these go hand in hand. What's your sleep pattern? So once your lipids are down, really, once you're exercising, the chances of having progression of heart disease is pretty low. When you do a test, guess what happens? I just had this 69-year-old gentleman, his stress test, nuclear stress test, was slightly abnormal, but because he's had heart disease, I decided to do an angiogram, but there was nothing that I could fix. So then retrospectively you figure out, should I have had done it? Because the person exercises a lot. I'll show you his picture when I'm done. Actually on the treadmill, his diet. He had his stents put in 9 years ago, 69 in good shape. So therefore we've realized that sometimes by doing tests, you only sort of create, in this country you create business for yourself. In the United States, you do unnecessary testing. And who's paying? It's a third party payer. And it's not a question of the third party paying, but is it necessary? So we've realized that this 90-year-old guys, I've done the angioplasty and stent 20 years ago. But why are they still alive? I've not done too many tests on them, but they are doing well because they have modified their lifestyle. I see people here, I'm like shocked. I told you to walk, right? I wrote this on your chart. 30 minutes of walking, what are you doing? You go for the same food, you had a heart attack. If you're not going to change your lifestyle, is a test going to change your lifestyle? I'd like to ask you the same question.
Well, I think it's at least ensure that if you haven't adhered to this advice that was given to you 12 months ago, the fact that you have a test now will ensure that you have deteriorated.
You know something? It's a double-edged sword, because if you want to, then there'll be a lot of doctors who are available to do your test every 3 months. You should go to them. And you should keep them happy. You know, what's in my wallet? Your money. Tests do not tell you anything. So if I want to do this, tests, actually, a couple of Indian doctors have been in trouble in the United States for unnecessary testing. We have what are called guidelines. The guidelines don't come in because somebody woke up one day and wrote something. There are a whole group of cardiologists who review the literature. Or like I said, you could get $1,000 whole body scan. But what did that end up with? Multiple problems. So I'm going to give you the same example. My office manager got admitted for dehydration. So this hospitalist, a doctor like a MD medicine, ordered, because the kidney function was slightly abnormal, he did not give her enough fluids. The kidney, he ordered a scan. So I called him and I said, can you enlighten me why that scan was done? Ultrasound of the kidneys. See what's happened to medicine. We have lost our brains and we believe in a test. Oh, no, doctor, he's MD medicine. Because, I just wanted to check. I said, I'm going to tell you something. Do you know what happened to her? She had dehydration. Did you hydrate her and then do it? No. So go by simple medicine. And I tell a lot of my patients, I don't treat tests, I treat people. I don't treat tests, I treat people. So if I treated tests, I could have told a guy who had this echo which was slightly abnormal, you need an angiogram. He may be your friend, he may be his friend. So I'm treating the test, right? I'm not treating the patient. So that's the whole thing. So this is what has happened. It's not the society, we are part of the society, and we've sort of enabled, we become enablers, thinking that test is the final answer. Give the mic.
Dr. Good evening. It's continuation with the walking. Normally recommended is 5 to 6 kilometers per day. Whether it should be done in one go or it's better to do it in twice a day. And second thing is, you have mentioned in the paper today that your sleep patterns affects your pressures. So can you elaborate it a little bit?
Very good.
And third thing is, it's very easy to tell, change the lifestyle. So just how to change it, what is required, just can you highlight on that?
So thank you for the questions. Your first question, he already answered it. So that was a total of more than 10,000 steps. Yes, exactly. No. Total in 24 hours, 10,000 steps. So it's very simple. Buy a Fitbit, it's pretty cheap, and that will show you how many steps you do. So I have a Fitbit, somebody gave it to me, it's a year old, that's what I do. So you know how many steps you do. So suppose you walk in an office, like I'll give you two examples. Now there is one office here where they still have files, dusty files, and the other office is on the computer. So these people at the computer, whole day they're sitting at the computer because they don't need to pick up that file. But the other office has files, so they've got to go up, come down, go up. And this is not only here, in my own office, that's a problem. The staff had to get the files. Now everybody is on the computer. So if you can do more than 10,000 steps a day, you can wear something, even on the iPhone, they have an app. So you can use that app for that. So that is number one. And coming back to your sleep pattern, it is extremely important. And I don't take anybody's excuse. If I'm a busy cardiologist sleeping in the afternoon in the United States, and I just had my 60th birthday, so the speech at my birthday was my son giving the speech on sleep. And my father, he has to sleep in the afternoon, come what may. So, why didn't people long time ago not have hypertension? Again, because they slept. There was nothing to bother them. What's happening is, we are using WhatsApp, of using them. And thank God, my phone doesn't work here. And the night I turn off my phone, so my phone doesn't work here till I'm at some friend's place where they have the internet. So it's great because I don't need to check my WhatsApp. I go to sleep at 10 o'clock and I wake up at 10 and I get tired because it's too hot for me. So I think one needs at least a good 7 hours of sleep. And I'm going to talk a little bit about the yoga. What is yoga? Actually, they have found out that people, and again, yoga is regimented. You cannot say, I'll go to yoga one day and then after 2 months go back to yoga. No. It is a daily practice. As a matter of fact, when I was 12 years old, I had gone to this yoga school in Chopati, Bombay, called Kaivalyadam. And I learned some few techniques. And they're all relaxation techniques really. So whatever relaxation technique you use, what are you doing? Your catecholamine release, that is these agents that get your blood pressure up, that get your heart rate up, you're slowing down your metabolism. Okay, because when you're doing yoga, you cannot think about yoga. You have to think only about, you have to be very focused. Very, very focused. So they have found that there is a condition called atrial fibrillation in people who, again, it's all regimented because you just cannot write in a good journal. People have to do these many minutes of yoga followed up for a year, not 6 months, for a year, that they've done well. Same way, the same condition called atrial fibrillation, people who are obese. In Australia they did a study where they cut down weight and they didn't have to have any. So really, why did people live so many years ago without so many medications? Let's figure that out. Let's figure the arithmetic here is obviously we are in a rat race, we need to do well, but at the same time we need to slow down and smell the roses. And what was your third question? I forget.
See, it is the generalized statements everybody does is change the lifestyle. Practically how to do it, what is advisable, what is not advisable. And one more just small thing, generally it is told that afternoon you should not sleep or you should not take nap also. First time I read in the paper today that it is advisable to take a nap for some time, at least 20 to 30 minutes. I think it is not mentioned, but sometimes you should take. Whether is it required?
To me, so I'm talking about me. It is required because, see, when I work from 7 to 3, it is non-stop. I'm walking, not sitting in my desk. By 3 o'clock, I'm ready to go for a nap. But let's talk about coming to your question. What is happening in on these top companies in the United States, the internet companies? They have your pod where you go in the afternoon to nap. Because when you nap in the afternoon, your creativity improves later in the day. You figure out for yourself. To me, I feel like $1 million if I have a 45 minutes nap. Because my creativity after that, I have a cup of tea, I get to doing things, and some people ask me, don't you fall asleep? So I said, I go to sleep by 11:30, by 11 o'clock and wake a good 6.5 hours, but I have to have a nap in the afternoon. Now coming back to you is what you need to figure out for yourself. How are you time management skills? If you don't know how to utilize your time, you need to write down what you do in the whole day. As a matter of fact, ever since I've come here, I've been writing down what I need to do. I've been writing down because, I'm getting old and I cannot remember everything. So even today's chores, when I woke up at 7 o'clock, where I'm going, so morning, so if you write down, you will realize how you are not using your time very fruitfully, because time management skills are very important. So people ask me, how come you go home at 4:35 in the evening? You're a busy cardiologist. I said, I feel sorry for you people if you all don't know how to utilize, why do we have cell phones? Utilize a cell phone for a good use. But time management skills, if you're just going to spend half an hour with someone drinking, the representatives come to me, I will take a bite with them, see a patient, because it takes me a long time to eat. So if I sit down there for an hour, my patients will be delayed. So I'll take a bite, talk to them for 2 minutes, and go and see a patient, come back, take another bite, another 5 minutes or so, and then I'm done by 3 o'clock, literally. Then we are on call, emergencies, and then when I slept so somebody calls me at 12 midnight, I'm still ready to go, ready to do a procedure. So I think it's very important. Make a timesheet for you, wherein what did I do every hour, what you've done, and you will realize, let's cut this out, let's cut this out, let's cut this out, because that way you realize I can use this half an hour to nap, right? And initially I used to come home and nap. Now I sleep in one of the rooms, once the patients are gone, I go and sleep in the room, and I fall asleep, and people wonder how come I fall asleep. And I say the rosary and I focus on the rosary. I don't focus about what needs to be done next. Because if I die, then somebody else will take my job, right? So why worry? Why worry? What did he just say? Where's that Juvino gone? He's gone. He said about worry, dilute your worries. Right? Go ahead. Sorrow, worries, stress. Go ahead.
Can I ask a medical question?
Sure.
Okay. What is a fluttering heart? Like you feel sometimes, like I am 62, and I sometimes feel that, the stick shift, gear changing cars, some kind of a feel like that at times I feel. I'm not worried about it, but I'm just asking since I got you.
Oh, that's a good question. Thank God you're changing gears, not, I thought you had a younger boyfriend or something. So, okay, you can get what is called a Holter monitor to document whether it's real. Okay, if it's not real, you may be imagining it. So get a Holter, and it happens to all of us. Get a Holter monitor done, because that will tell you whether you truly have skip beats. And if there are very few skip beats, you don't need to do anything about it.
Ah, okay.
And coming back to your skip beats, there was a before 1989, they used to treat people with skip beats. Then they did a study. They found that the people who were treated for skip beats, that more people died after they were treated. More people died after they were treated than those people who got the placebo. So that's why you have skip beats, nothing to worry about. Keep away from that boyfriend of yours.
Okay. I don't exercise a lot, but I do pranayam and yoga.
Yeah, okay.
Yeah, but I don't walk. I drive a lot, and I definitely have a healthy food habit and everything. But somehow I have not been able to check on my cholesterol. I don't know what's
Check on your cholesterol, or
it's on the borderline. It's been almost about 15 years, and I haven't got an increase of weight, maybe 1 or 2 kilos.
Now, I can't ask you any personal questions here.
Oh, okay.
Because you said 15 years now. So it's the same.
Yeah, it's almost around the same. And a couple of marks going up
Coming
and
back
down.
to what you said. Do we need to treat the cholesterol, or do we need to treat you? I don't treat tests.
Okay.
I treat people. If it ain't broke, don't fix it. If it ain't broke, don't fix it. So the whole issue is, I use a lot of cholesterol medication, by the way. But there are a lot of patients. You know what I tell them? If I live to be 85, I have a lot of 85-year-old patients. So I live to be 85, I'll be smoking pot. You know it's pot, right?
Yeah.
So they said, doctor, give me a prescription right now, I'm above 85. So we can't worry about, if it's the same, you're lucky.
Yeah, I'm not worried.
So
but I just thought
cholesterol
that-
is
check it
just
out.
a number. I'll give you an example about another British trained doctor who came to the United States. So he sees this patient, this is a real thing, the doctor writes in the, so the British trained doctor comes to the United States and this patient has come in with bleeding. So the silly patient asks this doctor, what is my cholesterol? Instead of asking what is my hemoglobin, she says, we are in love with all this stuff that is being shown to us all the time. Yes, if you have heart disease, then yes, you need to get your cholesterol down to certain levels. But if you are sailing, why simply, try to change directions?
That's where my first question was, that does those pathological tests regularly help in any way?
That is
It
of
doesn't.
no consequence as long as you maintain. And I would add to your pranayam, 10 to 15 minutes of walk is not going to kill you. If anything, it's going to keep you away from the doctor.
Okay. Thank you.
You're welcome. There. Give him the mic.
Doctor, what's your take on the usage of coconut? Because a lot of coconut is being used in our food here in Goa.
Thank you very much for that question. A very interesting question. Now, coconut, I cook, so I know about food. Be it, actually, one of my friends came in from India to see me and I made a dosa, masala dosa. I said, how come you make a dosa without oil? I said, I'll teach you how to make dosas in America on a non-stick pan. So coming back to the concept of coconut, I think coconut in moderation is very good. But what happens when we make the coconut curry? Sometimes we tend to cook it and cook it and cook it till the oil comes out. Okay, I don't know, and I'm not an authority, so I don't know whether that process, be it coconut oil, be it olive oil, or coconut oil or olive oil, sort of breaks down certain areas in the chain that manifest as either carcinogens or, cause worsening of your lipids. So on that point, I have realized that unless you can eat coconut, but let me just ask you, say 50 years ago, how many people had coconut curry? How was the coconut curry made? What was their diet? It was mackerel. I know that 50 years ago you could get mackerel, you could get like 100 mackerels for a rupee. Okay, so mackerel in a coconut curry, mackerel is full of very good fish oils. Now people prefer pomfret, but mackerel is the thing to do. How many people continue to eat mackerel then? And even when they had coconut curry, it was not boiled and boiled till you get the oil. Boiled till you get the oil, So it was a nice, good coconut curry which was not boiled and reboiled. So I think, how many people ate coconut curry like, having a soup? So moderation, I don't see any problems in having coconut curry as long as you expend your calories, right? So those people, even if they ate a lot, I don't remember seeing any fat person 50 years ago, right? I don't know if anybody else. I'm just 60, so I'm talking when I was 10 years old. So I think it's not a problem at all, but in moderation. You want me to just let her finish it?
Doctor, coconut oil solidifies at low temperatures, whereas olive oil doesn't.
Sorry, say that again.
Coconut oil solidifies at low temperatures, whereas olive oil does not. So what is the effect in the body, coconut oil?
Now, I don't know much about it. And in America they teach us, if you don't know, don't give your 2 cents.
And
So
yes, and there's a lot of hype about virgin coconut oil. Virgin coconut oil.
Now how can they get virgin coconut oil? Which are the virgin coconuts? I'd like to know.
No, which is made of tender coconuts. Cold
pressed. Okay,
yeah.
wait. Cold pressed. Now, otherwise, how do they make coconut oil?
Of dry coconut.
No. Coming back to, I know about coconuts and coconut oil because there are a lot of coconut trees. So coming from Bombay, we could take dry copra, or we would make oil out of it. And then out of whatever remains, you use it for the cattle feed. So I know all of this from 40 years ago. So I love everything in life. So paint, they call it paint, right, in Konkani? See? I have not forgotten my Konkani. So that was not hot pressed, whatever we did. So what do you mean? I'd like to learn from you if there's something else that is being done. So the cold pressed is the same thing. It was not hot pressed at all. It's like making the coconut, the sugarcane juice. Same thing was for coconuts. Correct me if I'm wrong. You must know too. So it was cold pressed. It was not hot pressed. So this is what I don't know, whether it's a marketing gimmick, right? I don't know much, so please, I'll be more than happy to learn. And now the other thing is tender coconuts. Most of you all are from Goa. Can somebody enlighten me whether they make tender coconut oil? No, okay, without drying. Oh, good. So I learned something. Oh, that's good. So this is from the fresh coconut that you can get oil. But we get the same thing and we call it coconut milk. So then it's not cold pressed. So dry or fresh coconut to me, in moderation, shouldn't be an issue unless you overboil the coconut. And I know I've done that at home once. So, just to see the oil coming out of the coconut. And you know what happens when you get oil coming out of the coconut? It's that film is a sealant. Once it gets, it's a sealant. You don't get fungus and all because of that sealant. And it's tastier because of the oil. You got it. And it's greasy or whatever. You know what I tell my patients? If it tastes good, spit it out. He's looking at me very suspiciously. Exactly, butter. Butter is so good.
Many of the European countries, actually they have a different lifestyle because they encourage cycling. In the 60s and 70s, people wanted to make their cities car friendly, but they opposed it and they make it bike friendly. And most of them, they don't walk, but do you have any statistics to find out whether their heart disease is much lower than the America or other countries who love their cars? And the second one is that to what extent the placebo effect, where the mind has a more power to cure your diseases, is effective in heart diseases?
Thank you very much. Very good questions. But I don't think I have answers to both of them. But I believe that mind, you know that, right? They have mind over matter. They have had a lot of studies, but not everyone can do that. You understand? Placebo effect. I think placebo effect is a very important thing. And I think the European lifestyle is also different. It's not only bicycling. I'd like to bicycle to work. But as a cardiologist, if I've got to be there in 10 minutes when somebody is having a heart attack, it's going to be difficult. And I fully agree. Now in New York City, they have bike lanes. You cannot drive in New York City. You cannot drive and I've seen people in the snow biking in those lanes. Because in the city nobody has too many cars. Parking, you cannot afford it. So a lot of them either have bicycles or walk. So I think And most of them are younger people, so it's nice that they do that. And I fully agree with biking. You know, we bicycled, right, as young people. All of us bicycled as young people.
But in India, it is never encouraged. In Goa, not a single road has got a bike lane. Of course, here the transport industry will not allow it.
Exactly, and really, you know, unless we got them for the meeting today, but, you know, I can't help them. They're beyond redemption. Go ahead.
Yeah, more of bikes.
Yep.
Most of the European cities have got a bike share. Where you go to a new city, you have got a bike ready everywhere, where you can just pick the bike and start biking.
That's what I told my nephew, right? I said to him, I bicycled to Chogle College, and through the rivulets, we carried a bicycle and then the books and everything, and then, but it seems like, and I don't know why people have so many excuses. You had a question?
Doctor, the modern fertilizers which are used to grow food grain, fruits and vegetables, they say that they are very harmful for the body.
Now, that's a good question, but I
Yeah.
don't think I know much about it.
Because in olden days we used to use the natural fertilizers. But now the modern fertilizers they use for growing the productivity, but indirectly it is very harmful. That's what the outcome is.
You know, I don't know the answer to that. I don't know much about that. But, you know, I'll just make a joke of the whole thing. And you know what? This young man has come to my place. In summer I have a garden and I show it to my patients. And it has tomatoes, cucumbers, everything. And so they asked me what fertilizers I put in. So I said, I pee in my garden. So then they said, what? Oh my God, you pee in the garden? I said, I call it the garden of peed in. And so the garden of Eden, I call it the garden of Eden. So just to make a joke of the whole thing, but I don't know much about it at all. Because it's more with people who work with cancer and all, but no. But no, I have fun with my patients. Actually, they entertain me. So, you know, and I entertain them. So laughter is the best medicine, right? So, and thank you very much for being here, because without you we would not have a talk. Thank you.